Hi, my name is Fatima and I will be presenting to you a case presentation on mental health nursing with a diagnosis of major depression in chronic kidney disease. The overview of my presentation includes introduction, anatomy and physiology, patient profile, pharmacological intervention, patient resources, and summary. To start with, depression is a disorder accounts for 1.5 to 4 times more prevalent in medically ill patients rather than in general population. According to Zalai et al., it is characterized by mood disorder and/or anhedonia, which is the loss of ability to feel pleasure. It is oftentimes associated with somatic, cognitive, behavioral symptoms such as loss of energy, changes in body weight, insomnia, difficulty concentrating, feelings of worthlessness, hopelessness, helplessness, excessive guilt, thoughts about death, and suicide. According to WHO, major depression is the third cause of burden of disease worldwide and projected as the first by year 2030. In practice, its detection, diagnosis, and management often pose challenges for clinicians because of its various presentations, unpredictable course, and prognosis and response through treatment. This is according to Malhi and Mann. In relation to CKD, a high prevalence of severe psychological distress was discovered with advanced CKD and its impact on CKD. Outcomes call for screening intervention integrated in routine renal care. The prevalence of depression is found to increase from early stages to later stages of CKD. Furthermore, patients suffering from chronic kidney disease has organized beliefs of treatment process. The predictor of non-adherence to depression and mortality in CKD patients is through identified illness perception of patients towards the disease process. This is according to Muscat et al. Moving on, determining psychological disorder factors associated with depression is important to understand that depression is not caused by one thing but a combination of factors which includes biological factors, psychological factors. In biological factors, it includes genetic factor, hormones, brain chemicals, which are the neurotransmitters. Psychological factors include thinking, loss, sense of failure, and stress. The anatomy and physiology of major depression is complex disease which can be triggered by several factors including chemical imbalances in the brain, medical condition, traumatic life events, and genetics. Pathogenesis of the depression is in relation to neuroplasticity and cellular resilience. Genetic neurodevelopmental factors, repeated affected episodes, illness progression might all contribute to the impairments of cellular resilience. Volumetric reductions and cell death, atrophy observed in mood disorders. On the other hand, stress and depression likely contribute to impairments of cellular resilience by a variety of mechanisms, which includes reductions in the levels of brain-derived from neurotropic factors, facilitating the NMDA and non-NMDA receptors, and reducing the cell's energy capacity. Moreover, brain imaging studies shows that depression affects changes in several parts of the brain, especially in three core areas. The first is amygdala, which regulates emotions such as anger, pleasure, fear, and when the person is depressed, the amygdala can be hyperactive, causing problems in sleep, behavior, as well as the balance in key mood hormones. The second is basal ganglia, which regulates group of structures deep in the brain, and they are connected to interact with structures that are closer to the brain surfaces. It involves in memorizing, thinking, and emotional processes. The third is hippocampus, which processes memory and regulates stress hormones such as cortisol. The key role here is the long-term memory. In addition, thalamus helps link sensory information to good and bad feeling. Problems in thalamus may be linked to bipolar disorder, changes to this part of the brain, and other mess with key hormones such as the serotonin, which regulates sleep and mood, and norepinephrine, which affects motivation. Further description of how depression affects the brain as discussed in the two links below for further reference. In relation to my case study, the patient profile is as listed. The name of the patient is Patient X, age is 55 years old, gender is female, culture is Emirati, community is in Fujairah. Living arrangement is a family home with a diagnosis of end-stage renal failure, major depression. History of psychobiological disorder includes chronic. Comorbidities is hypertension and diabetes. Existing social support is that the patient is aloof and is seldom seen with family member. Admission date of the patient was on June 10, 2023, and the anticipated discharge date is on July 10, 2023. Nursing care plan on admission for the patient is the priority is risk for self-directed violence, and then the secondary is ineffective coping related to situational crisis by lack of goal-directed behavior and inadequate problem solving. The nursing care plan on discharge includes readiness for enhanced health literacy related to anticipated discharge. Nursing care plan of the patient includes risk for self-directed violence. This aims to provide safe environment, preventing harm to patient, and verbalize emotions, seek help when experiencing self-directed harm intentions. Additionally, patient will develop absent manifestation of depression. Another nursing care plan includes ineffective coping related to situational crisis by lack of goal-directed behavior and inadequate problem solving. This aims to encourage verbalization of emotions, ability to cope, and ask for help when needed, and demonstrate ability to solve problems. Further nursing care plan includes readiness for enhanced health literacy related to anticipated discharge. The aim of this is to provide available resources for follow-up monitoring, provide knowledge on medication administration, and identify patient resources available and is accessible, develop activity plan for social interaction to achieve optimal health for the patient. Moving on, in pharmacological intervention, antidepressant medications are most commonly used for help to relieve distress of depression and/or anxiety. Antidepressant medication can take up to several weeks to be fully effective. Early signs that the medication is working includes improved sleep, appetite, and energy. Medications for depression includes SSRIs, TCAs, and related compounds, mixed norepinephrine, serotonin reuptake inhibitors, and MAOIs, or MAOIs. The nursing responsibilities to this is to ensure success of antidepressant medications through patient care management, medication monitoring, depression, education, referrals to specialty providers. Antidepressants help many people. However, they don't work for everyone. Even when they work well, they can only do so much. They often work best when they are combined with talk therapy, support from the family and friends, and self-care, such as regular exercise, nutrition, and diet, getting enough of sleep. In determining the common side effects of these medications includes the following common side effects of SSRI, MAOIs, and TCAs. SSRI includes nausea, vomiting, diarrhea, weight gain, dry mouth, headache, anxiety, sedation, and decreased sexual desire. MAOIs include orthostatic hypotension, insomnia, swelling, and weight gain. TCAs include drowsiness, blurred vision, constipation, dry mouth, orthostatic hypotension, and urine retention. Furthermore, depression medication algorithm is quite important in following up the treatment process of the patient. This includes the contact frequency of the patient's medication assessment frequency, the response of the patients to medication administration, and the criteria for medication change if there is a need to change one, as well as the evaluation of the entire overall health of the patient. Patient resources in the UAE includes the following. German Neuroscience Center is a physical branch in Dubai Healthcare City that caters patients suffering from depression. There are also hotlines which includes mental support line and as well as the Seha Estijaba helpline. These are all available 24/7 for patients who are suffering from depression in the country. In summary of this case presentation, depression is real and in an amount of attention to be given to all patients suffering from it weighs the same with other illnesses. Depression is recurrent, common, chronic that require treatment according to Kupfer. He further states that depression occurs in entire life cycle and the most common of psychiatric illnesses. It is a long process of treatment where dedication and consistency in therapy will help achieve treatment plan. It is a vital process to achieve desired goals such as expression of emotions, safe environment, support system, and coping strategies that will guide patient get through to life challenges. Patients diagnosed with chronic illnesses have impact on major depression episode of the patients. Learning and understanding, individualizing patient care through adequate assessment and determining strategies in formulating plan for each need will increase patient quality of life. Awareness of mental health disorder is important to mitigate mortality rate among age group and eventually help society build more an accessible helpline that will guide patients with appropriate patient care. Patient is the core of nursing and helping them all throughout is necessary, especially with chronic illnesses associated with mental illnesses, to promote safe and quality of life for all patients worldwide. That will be all for my case presentation. Thank you for listening to this presentation. If you need a references for this, kindly refer to this references list. Thank you so much for listening and God bless.